There's this question. It sort of floats around, maybe pops up in late night searches or comes up in quiet chats between friends. It's about something really common, but, well, it's surrounded by a ton of misinformation, a lot of fear, and just old wives' tales, really.
Absolutely. A topic many wonder about but don't often discuss openly.
Exactly. So today, we're going to dig into it. What really happens to your body, specifically your prostate, if you engage in, let's say, a certain daily act, an act that's had so many warnings attached to it for years.
Warnings that often lack any real scientific basis.
Right. So if you're ready for some surprising science-backed insights, the kind that really bust common health myths, you should definitely hit that subscribe button now. Because this deep dive, it might just challenge everything you thought you knew.
Yeah, the whispers you've probably heard maybe online or just talking to people, they often suggest danger, don't they?
They do.
That doing this act frequently could, damage your prostate, cause chronic inflammation, or worse. The fear-mongering has been pretty intense.
It really has. For generations, these ideas just got passed along. Sometimes maybe as moral warnings, other times just taken as, well, unshakable truths.
With very little solid science to counter them for a long time.
Exactly. But that's what we're here for today. Our mission is to cut through all that noise, debunk those myths that have stuck around for so long, and give you accurate, evidence-based info on this really vital part of men's health.
And the truth, as you hinted, is probably not what most people have been led to believe.
Not at all. So to really get why the science is so, well, shocking, maybe we should start with the basics, the prostate itself.
Good idea. So the key player here is the prostate gland. It's actually pretty small, only about the size of a walnut.
Tiny, really.
Yeah, but incredibly important. It sits just below the bladder in front of the rectum, and its main job in the reproductive system is producing the fluid part of semen. This fluid nourishes and transports sperm.
So a small gland with a huge role in men's health, especially as men get older.
Definitely. And because it's so important, it unfortunately becomes a source of a lot of anxiety.
Oh, for sure. You hear the stories, right? In locker rooms, online forums. Sure. The idea that frequent masturbation can somehow wear out the prostate.
Yeah, that one's common. Or that it might lead to chronic inflammation, prostatitis.
And the scariest one for many, I think, is the claim that it could actually increase the risk of prostate cancer.
Which is understandable, given that prostate cancer is one of the most common cancers affecting men. If something routine could impact that risk, of course people are concerned.
Yeah, it makes sense to worry. And like you said, for decades, these fears, these myths, they just kind of existed, largely unchallenged.
They were often dismissed as just, old wives' tales, or maybe advice that was meant well but wasn't really based on facts. There wasn't a strong scientific voice pushing back.
Until researchers at a really prestigious university decided it was time to find out for real.
Right. They set up this massive long-term scientific study. The goal was finally put these deeply rooted myths to the test.
And what they found wasn't just a small correction. It basically flipped the script entirely, didn't it?
It absolutely did. It fundamentally changed how we understand prostate health and the role sexual activity plays.
Okay, so let's get into it. What did this huge study actually find? Let's talk about landmark research here, right? From Harvard.
That's the one. A really significant study. And let's be clear, this wasn't some tiny survey based on recall. No, this was an exhaustive effort. They followed nearly 32,000 men.
Wow, 32,000?
Yeah, for almost 2 decades. They meticulously tracked their lifestyles, their health outcomes, and crucially, ejaculation frequency was a key piece of data they collected.
So tracking them for that long with that many people, you're going to get some solid data.
Exactly. And when they analyzed all that data, the results were, frankly, stunning.
Okay, lay it on us.
They found that men who reported a higher frequency of ejaculation actually had a significantly lower risk of developing prostate cancer.
Lower risk.
Not higher. Lower. Directly contradicting those long-held fears. It's profoundly counterintuitive if you've only heard the myths.
Wow. Okay, do we have specific numbers? Because that sounds huge.
We do, and they're compelling. Men who ejaculated 21 or more times per month showed up to a 33% lower risk of getting prostate cancer compared to men who only ejaculated, say, 4 to 7 times per month.
33% lower. That's a massive difference. So the very thing people were worried about actually seems to be protective.
The evidence strongly points that way, yes. A powerful protective effect, the complete opposite of the fear.
And this wasn't just a one-off finding, right? You mentioned other research.
Correct. It wasn't isolated. These results have been backed up by other major studies since then. There was a large Australian study, for instance, that found very similar protective links.
So the science is pretty consistent on this now.
It really solidified the understanding, moving it from a surprising finding to a robust piece of scientific knowledge.
That's incredible. Such a turnaround from the old way of thinking.
Yeah.
But it does make you ask why, doesn't it? How can something so, well, simple have such a big impact on prostate health? What's going on biologically?
That's the crucial question, right? And scientists have developed a few leading theories, and they actually make quite a bit of sense when you look at them.
Okay, what's the main one?
One of the most prominent is often called the prostate stagnation hypothesis.
Stagnation, okay.
Yeah, think of the prostate gland having this network of tiny ducts inside it, almost like little pipes.
Gotcha.
This theory suggests that regular ejaculation essentially acts like a flushing mechanism for these pipes. It helps clear out old cells, any built-up secretions, and maybe even potentially harmful substances or carcinogens.
So things that could otherwise just sit there and potentially cause problems, like inflammation or triggering cancerous changes.
Exactly. It prevents them from lingering. It's like a natural cleansing process for the prostate.
Okay, keeping the pipes clean. That makes intuitive sense. What else?
Well, the second main idea focuses more on cellular health, specifically cell turnover.
Cell turnover.
Yeah.
Like replacing old cells with new ones.
Precisely. You know, every single time a cell divides anywhere in our body, there's a tiny, tiny risk of a genetic mistake, a mutation. And those mutations potentially can lead to cancer down the road.
Right, that's just basic biology.
So the hypothesis here is that frequent ejaculation actually promotes a healthier, more efficient cycle of this cell turnover within the prostate. It encourages the gland to replace older, possibly damaged cells with fresh, healthy ones more regularly.
So by constantly refreshing the cell population, there's less opportunity for those potentially cancerous cells to kind of take hold and multiply.
That's the idea, reducing the window of opportunity for cancerous changes.
Interesting. Okay, that's two. Is there a third main theory?
There is, and it ties into something we often talk about regarding overall health: stress and inflammation.
The usual suspects.
Pretty much. We know that chronic inflammation is a major risk factor for many types of cancer, including potentially prostate cancer.
Right.
And the act of ejaculation itself, it's linked physiologically and psychologically to a reduction in tension and stress.
Okay, yeah, that makes sense.
So the thinking goes, by helping lower overall stress levels, you might also be helping to lower the body's general inflammatory response. This creates a healthier internal environment, less conducive to the kind of conditions that can promote cancer growth in the prostate.
So it's a combination. Flushing things out, healthier cell replacement, and maybe lower stress and inflammation.
When you put them all together, yeah, they paint a pretty clear picture. Regular ejaculation, whether it's from sex with a partner or masturbation, seems to play this significant role in keeping the prostate healthy through these different mechanisms.
It's a powerful combination of effects.
It really seems to be.
Okay, so the science is clearly pointing towards a benefit, a reduced risk with more frequent ejaculation. That's honestly amazing. But I guess the next logical question is, okay, is this like a magic bullet then? Is frequent ejaculation the key to preventing prostate cancer?
Yeah, that's where we need to bring in some important nuance. And the answer is probably not a magic bullet, no.
Okay.
It's really crucial to understand the difference between correlation and causation here. The research shows a very strong link, a strong correlation.
Meaning the two things happen together, higher frequency, lower risk.
Exactly. But it doesn't necessarily prove that the ejaculation itself is the sole direct cause of that lower risk.
What else could be involved then?
Well, it's possible, for instance, that men who tend to have a higher ejaculation frequency might also, on average, have other healthier lifestyle habits. Maybe they exercise more, or eat better, or smoke less.
I see. So it could be the combination of factors, with ejaculation frequency being one part of a generally healthier picture.
That's a possibility researchers consider. So while the link to ejaculation is strong and the theories make sense, it's probably best to see it as one important piece of the puzzle.
Right. Not the only piece. Think of it like a tool in the toolbox for prostate health, maybe?
That's a great way to put it. A significant tool, absolutely. But you definitely need the other tools in there too. It's not a license to ignore everything else.
Okay, so let's talk about those other tools. What else is critical for maintaining prostate health besides this frequency aspect?
Well, diet is definitely high on the list. Eating a diet that's rich in fruits, vegetables, and healthy fats is strongly linked to better prostate health overall.
Any specific foods that stand out?
Yeah, some research highlights foods with lycopene think tomatoes, watermelon, pink grapefruit. They seem particularly beneficial. Green tea also shows promise, as do foods rich in omega-3 fatty acids like fatty fish.
Okay, diet. Check. What's next?
Exercise. No surprise there, right? Regular physical activity helps maintain a healthy weight. And that's really important because obesity is a known risk factor, especially for more aggressive types of prostate cancer.
And it doesn't have to be marathon running, I assume.
Not at all. Even just 30 minutes of moderate exercise like brisk walking most days of the week can make a really significant difference.
Good to know. Tool number 3.
This one's pretty straightforward. Avoid smoking completely and limit alcohol consumption. Both are just generally bad news for cancer risk and overall health.
Right. Those are pretty standard health recommendations across the board.
They really are.
Okay, so diet, exercise, avoiding smoking, limiting alcohol. What's the final, maybe most crucial tool?
Arguably the most important one. Being proactive with your medical care. Regular checkups.
Can't replace seeing your doctor.
Absolutely not. Nothing we've talked about, not diet, not exercise, not even ejaculation frequency, takes the place of regular visits with your doctor. This is especially vital for men over, say, 40 or 50 or younger if you have a family history of prostate cancer.
And talking to them about screening.
Yes, having that conversation about screening options like the PSA blood test is still the single most effective way we have to catch potential problems early.
And early detection is key.
It often makes all the difference in treatment outcomes, catching things when they're most treatable.
Okay, so let's bring it all back together. We started with this common fear, this anxiety around frequent ejaculation and prostate health.
Yeah, the idea that it was somehow harmful.
Right. But the unbelievable truth, backed by really solid top-tier science, seems to be the opposite. Far from being harmful, frequent ejaculation might actually be one of the simplest, most natural things you can do as part of contributing to a healthier prostate long-term.
It's a significant shift in perspective. Now, again, it's not a magic cure-all. It absolutely doesn't replace a healthy lifestyle or those crucial doctor visits.
Definitely not.
But the evidence linking it to reduced risk is, well, it's incredibly compelling. You can't really ignore it.
So the big takeaway seems to be that a healthy sex life, and yes, that includes masturbation, it looks like it's actually a partner in promoting long-term prostate health, not an enemy.
That's a great summary of what the current science suggests.
Which really makes you think, doesn't it? We start to acknowledge this, really integrate this scientific understanding. How might that change the broader conversations we have about male health, about masculinity, even about self-care in society?
That's a powerful thought to consider. Definitely food for thought.
It is. Well, if you found this deep dive helpful, if you like getting health myths busted with real science, let us know. What other health myths have you heard that you'd like us to dig into?
Yeah, drop your thoughts or questions in the comments below. We'd love to hear from you.
And please make sure you subscribe to the channel, tap that notification bell so you don't miss our next deep dive. Stay healthy, stay curious.
And we'll see you next time.